Overdose prevention and education training. Mission of Narcan and the new laws that support the use in the school district is to reduce mortality, decrease adverse reactions, and review best practices for opioid prevention. So the Senate bill that supports Narcan use in the school district is Senate Bill 629. Narcan is supplied to Texas organizations and is federally funded, and it is available for purchase over the counter. By the end of this in-service, you will be able to explain how opioids work and their differences and similarities, define 3 major risk factors for opioid overdose, recognize the signs of opioid overdose, respond to an opioid overdose, and use naloxone, or Narcan, is the trade name, and be able to describe the law in Texas pertaining to Narcan's access and administration. Global trends currently, according to the World Health Organization 2023, there were an estimated 25.9 million people who experienced an opioid use disorder. Also, there were 46.3 million Americans with substance use disorders, and 745,000 individuals had a heroin use disorder in 2017. Overdose has become the leading cause of unintentional deaths in the United States. All opioids the same. Some similarities include that they all come from the opium poppy or are chemically treated to be like a drug which comes from the poppy plant. They impact the same part of the brain. They cause respiratory depression and failure. Some differences, they have varying concentrations and strengths, and their durations are different as well. Examples of opioid durations are methadone. It lasts for 24 to 36 hours in the system. Heroin, 6 to 8 hours. Oxy, 3 to 5, except for extended release formulations. Codeine, 3 to 4 hours. Demerol, 2 to 4. Morphine, 3 to 6. And fentanyl, 2 hours. However, it is also available as a patch, which lasts 3 days. Fentanyl is a potent synthetic opioid drug approved by the Food and Drug Administration for use as an analgesic and anesthetic. It is approximately 100 times more potent than morphine and 50 times more potent than heroin as an analgesic. Most of the fentanyl that we experience on the streets of Texas is produced illicitly manufactured, or IMF. So these are examples of deadly doses. Fentanyl deaths are up 540% in the past 3 years. This will put a little perspective on how much it takes of each opioid to cause an overdose or death. Narcan. Opioid antagonist, which reverses opioid overdose, and it comes in an injectable or intranasal form. We supply intranasal within the school district. Pushes most other opioids off the receptors, then sits on the receptor, preventing it from being activated for 30 to 90 minutes. An analogy is getting the wrong key stuck in a lock.
This information is brought to you by Team
Reversible opioids: codeine, fentanyl, heroin, hydrocodone, hydromorphone, illegally or illicitly made fentanyl or IMF, methadone, morphine, oxycodone, oxycontin, percodone, Percodon, and Percocet. Narcan does not work for non-opioid sedatives such as alcohol, clonidine, Klonopin, Elavil, Valium, Xanax, stimulants like amphetamines or cocaine. Let's talk about some myths versus fact. Myths. The risk of clinically significant exposure to emergency responders is extremely low. No reports have surfaced providing opioid toxicity is possible from brief incidental contact with opioids. For opioid toxicity to occur, the drug must enter the bloodstream and brain from the environment. Opioid toxicity cannot occur from being in proximity to the drug. Carfentanil, an opioid used to sedate large animals, must reach the bloodstream in order to produce any effect. Fact: inhaling airborne powdered fentanyl is possible and can lead to harmful effects. However, this form of transmission is less likely to occur than skin contact. While skin contact can occur during daily activities, immediately wash the area of skin that has been exposed and which will prevent any harmful effects of the substance. Protect yourself. Wear PPE. Avoid any action that may cause powdered fentanyl to go airborne. Follow your department guidelines if the scene involves large amounts of suspected fentanyl. If exposed, to prevent further contamination and inform other first responders before dispatching. Do not touch your eyes, nose, mouth, or any other skin surface after touching a potentially contaminated surface. Wash skin thoroughly with cool water and soap if available. Do not use hand sanitizers. While this may seem like a viable solution, hand sanitizers can actually increase absorption of the substance. If your clothing, shoes, or personal protective equipment has been contaminated, follow your department's guidelines for decon. Respond. Move away from the source immediately. Call EMS. Administer naloxone or Narcan according to our procedures and policy. You may have to administer multiple doses. If naloxone is unavailable, use rescue breathing to keep the individual responsive until EMS arrives. Use standard basic life support safety precautions. When addressing the exposure risk, if need be, use CPR until EMS arrives. The physiology of overdose is your breathing slows, it stops, your heart stops, and then circulation of blood to the brain stops. The overdose continuum. Overdose is rarely occurring immediately. It can happen over the course of 1 to 3 hours. Heavy, uncontrollable nodding. They're still arousable, but snoring or breathing loudly. Overdose. They become not responsive. Very shallow breathing or gurgling. Skin changes, blue lips and nails. A fatal overdose would include respiratory arrest. The cure for an opioid or heroin overdose is oxygen, breathing support, and airway control. First, tap the person's shoulder. If that doesn't work, try pinching an earlobe or fingertip. Ask, "Are you okay?" Shout the person's name. Shout, "Wake up." If no response, continue. Step 2, roll onto their back. Do this as gently as possible to avoid injury. Grasp the angles of the lower jaw and lift with both hands, one on each side, moving the jaw forward. If the victim's lips are closed, open the lower lip with your thumb. Peel back the container of the Narcan. Place your thumb on the bottom and then both your pointer and index finger on either side of the nostril nozzle. Insert into the nose until your fingers meet the nostril and the majority of the tip is inside of the nostril. Press to release all contents. Step 4 is placing that person, student, staff member in a recovery position. If you have to leave the scene, give first aid and put survivor in the recovery position. Narcan can cause withdrawal in individuals using opioids. Withdrawal can be very unpleasant. More than one dose may be needed. You may administer the second dose after 2 to 3 minutes following the initial dose. Individuals still need to seek medical attention even after Narcan use. Because if you remember previously, it only lasts in your system to lock out those receptor sites for 60 to 90 minutes. An overdose can occur over the course of hours.